Yeah, so shall we start, ma'am?
Yeah. Okay. Good afternoon, everyone. Hope you all are doing well and staying fit. I, Anushka Agarwal, welcome you all to this talk show presented by Mangalam Plus Medicity. Today we have with us Dr. Rahul Saini, currently practicing at Mangalam Plus Medicity as a consultant neurologist. I would like to welcome Dr. Rahul Saini to this show. Welcome, Doctor.
Thank you, ma'am, and thank you and good afternoon to all audience.
Yeah. So let's start with our topic, which is post-COVID headache and impact of COVID-19 on migraine.
Yeah.
So my first question, a very basic question, what exactly migraine is? When should I consult a doctor and what should I expect?
See, migraine is a very complex thing, I would say. It has many aspects. It may be caused due to, in some patient, it is due to genetic. It usually run in family. Plus, it is more common in those person who takes a lot of pressure and lives a tense life. Okay, the most common pattern is unilateral headache, mostly unilateral, but it may change site.
Okay.
So, and it usually starts in teenage, but it can affect any age group. There is no age specific group which is untouched from this disease, and it is so trivial in nature that usually patient is not able to recognize that he is having trouble actually.
Yeah.
The frequency can be quite low, like once in 2 months, once in 3 months, that people usually take it for granted. But the trouble is start when the frequency goes on rising. And this usually happen when there is a stress in life or there is cold or somebody fell ill. Now here comes the role of the COVID.
Yeah.
Usually it has been seen that the person who is having a infrequent headache, like once in a month or once in 3 months,
Mm-hmm.
after having a COVID, this frequency usually jumps. It becomes quite frequent, like twice in a week, thrice in a week, and then he realizes that this is a new onset headache. But when we probe, it comes in our knowledge that this headache was there previously also, but it has been triggered by the COVID.
Okay. So now that we have shifted to an online mode, I believe that not a single person is there who's not exposed to all of these electronic gadgets, right?
Yeah,
So,
they also
acco-
play a role.
yeah. So, according to you, which age group is the most affected by migraine?
I usually see most of the young person who is especially IT professional. They have a
Yeah.
very frequent headache, and they usually blame it to the their screen time or their eyesight. But actual cause is migraine.
Okay.
When they go to get their eyesight checked, it is come in their knowledge that eyesight is okay, but it is
Yeah.
something else which is causing this headache. Then they usually come to a neurologist for a proper diagnosis and management.
So, next question. What are the causes of migraine?
See, the exact cause is unknown. We can
Okay.
discuss it about, we can discuss about the trigger. The
Okay.
usual trigger, by trigger I mean those particular action which cause the onset of the headache.
Mm-hmm.
So they are known as trigger. The common trigger which is usually noticed are lack of sleep, improper sleep, stress, any emotional upset, traveling via bus or car, uh, and obviously screen time,
Yeah.
uh, on being on laptop for long working hour, it can also trigger. Some person have a trigger due to smell. Strong odor can also cause onset of headache in some person. So
Yeah.
these are the usual trigger which is noticed, and some people also experiences onset of headache by extreme cold or summer.
Okay. So,
So
like causes of migraine and a normal headache, like they are very common. The reasons that we have, they're very common for both of them. So, like,
hmm,
how do we differentiate if we have migraine or not? Because considering headaches normal, this overshadows
hmm.
a lot. This overshadows getting diagnosis for migraine, right? So, how do we differentiate from migraine and a normal headache?
See, migraine usually have a long history plus family history.
Okay.
Okay, once in a while, all of us get headache. But if it become a pattern that somebody is experiencing headache once in a month or twice in a month in a pattern-like manner, then there is high probability that particular headache is migraine. Now, here comes a question that when this frequency goes on increasing, then only the person realize that he should now consult a doctor. Otherwise, once in a blue moon, everyone get headache. Nobody is bothered about that. But when it becomes on regular basis, then I would recommend that one should visit a neurologist.
Okay, so now let's move on to the COVID aspect of our topic. So,
Hmm.
yeah, so I wanted to ask if the post-COVID headache, is it similar to migraine in any way?
We can say so because see what has happened because COVID is an entirely new entity.
Okay.
All of these are just an observation, but it has been observed that those person who has encountered COVID usually either their frequency of headache increases if they were having history of headache previously also, so
Yeah.
their migraine frequency become more, or even the new onset headache has also been reported in the patient with COVID. After encountering COVID, their frequency of headache goes on increasing, and they ultimately land up in a migrainous pattern, which is very difficult to differentiate from a usual migraine.
Okay. So, I was reading this article on BBC that COVID-19 causes respiratory failures and deaths, which is not through the damage to the liver. It is because of the brain. Like,
Hmm.
some patients had symptoms like, seizures, strokes, or headaches. So, can you please validate this fact by giving your inferences, your observations?
See, you have heard that there is a loss of smell and taste during COVID.
Yeah.
So, the smell and taste are brought to the brain via nerves. So that is an indication that COVID, where in a very early stages, involved our brain and nervous system.
Yeah.
So when the nerves are involved and the virus reaches till brain, it is start
Yes.
infecting the brain also. And there has been reported that more the severe the disease goes, the higher is the chances that will get involved. And that is
Okay.
the reason that because this virus start damaging the brain directly, as well as via the cytokine storm, as well as via the when other organ are damaged, the ultimate effect also comes to the brain. So all these things compile up and bring down the brain. In that way, the brain is also involved in the COVID infection. So if the patient goes on ventilator due to respiratory failure or other system failure, the brain will also be damaged.
So, are you saying that if a patient is suffering from any neurological disease, they won't
Hmm.
be able to suffice? They won't be able to survive?
No, 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 no. See, our body has a beauty to repair itself.
Yeah.
So if we give him a chance, like if there is a respiratory failure, because of respiratory failure, the brain is not functioning properly. The
Yeah.
patient is taken on ventilator. The lungs start recovering. Ultimately, brain will also recover, and he will recover back.
Okay.
But if some damage has been done during this whole process to the brain, that damage takes a lot of time to repair, and that we can see its complication in the form of seizure, lack of attention, loss of concentration. In that form, we can see some sequelae of the COVID on the
So
brain.
the COVID effect might be a lifelong effect on the brain.
If in the case, if it goes in a serious stage, that patient has to go on the ventilator and the disease was severe, we might land up in some permanent damage to the brain.
Okay. So next question. So like getting a headache post COVID, is it like a very common, like symptom after COVID recovery?
Yeah, it is very common. It has been found that uh, myalgia, which means the body pain, headache,
Yeah.
as well as encephalopathy in the form of lack of concentration, lack of drive, and a similar sort of thing are the most common symptom reported by the patient who has recently recovered from the COVID.
Okay. So I have heard that many people have developed like flu-like symptoms after receiving the vaccine.
Hmm.
So what do you suggest to people who have frequent headaches or might be having a migraine? So what do you
Hmm.
suggest? Should they get vaccinated or should they avoid it?
See, there is no other choice. They have to get vaccinated. Okay, it has been noticed that the this migraine has been triggered, or in, frequency increase has been noticed after getting
Yeah.
vaccinated, but that is very, I would say, very low cost in comparison to the benefit which we can achieve after getting
The
vaccinated.
vaccine. Yeah.
If
Okay.
we are not getting vaccinated, we are staking our life at a risk. But if we are getting vaccinated, we are only getting headache which can be managed easily.
Yeah. So should we like take a prescription for the headache from a doctor?
Yeah, yeah. If after getting vaccinated, somebody start experiencing headache, you consult a neurologist, and that can be managed very easily. That is
Okay.
not a life-threatening issue.
Yeah.
But not getting vaccinated, you are risking your life.
Yeah. So like any treatment for the post-COVID headache?
Yeah. See, first thing is to avoid the trigger. That is the best thing which we can do. All person who is regularly experiencing headache, by the time he comes to doctor, realizes that there are some work after which this headache comes.
Yeah.
If we are able to recognize them, try to avoid them. Number one. If the headache is very low or mild type, you can take a paracetamol or brufen or combiphylline type of drug, which are over the counter available. But if it get very frequent, then you will have to consult a neurologist for the management of the this headache in a proper way.
Migraine basically affects which part of our brain?
It affect whole brain.
Okay, whole brain. Okay. So sometimes it happens that we skip our meals, right? We
That is also a trigger.
it okay. So like because sometimes we skip meals and we think that because we've skipped meals we've gotten a headache, so we just don't consult any neurologist. So do you suggest that we should consult one if we are
See,
having?
if you know that skipping meal will cause the headache, try not to skip a meal.
Yeah, yeah.
That is the best solution. But if you are at a risk that this will happen, that you will not be able to take meal at a particular time, then of course, and the frequency of this headache is quite severe, like more than a 5 in a month, then you should consult a neurologist, because there is
Okay.
no point in taking painkiller on regular basis for a very long time. They do have their side effects.
Okay, so is this migraine? Is it a lifelong disease or there is any cure for it?
See, usually what happens that whenever the person has a stress in his life, the
Yeah.
frequency of this headache increase. And as the age, as the person matures and ages, the frequency of headache goes on decreasing. This is a usual pattern, but exception do happen.
Okay, so do you suggest anything that we should include in our diets to, avoid
I
getting?
would suggest what to avoid. Avoid
Yeah,
excessive tea,
yeah.
excessive coffee, and Chinese food. These
Okay,
things are known to cause trigger. But
okay,
if you once develop headache, then taking coffee and tea would help to cut that headache. It is very complex relationship. That taking
yeah.
strong coffee without headache will bring on headache. But if once there is a headache, then taking coffee will help you to get relief from the headache.
Okay, so like some doctors suggest us taking coffee like 2 cups a day.
Hmm.
So should we like take it twice or?
Twice is sufficient. There is no harm in taking once or twice, but some people have a tendency to take 10, 5 to 10
Yeah, because of the
cup.
stress and work.
That
Yeah.
that usually triggers then the problem starts.
Okay. So I am done with my questions. Let's see if we have any live questions. 1 minute.
Yeah. Your curiosity suggested that you also frequently suffer from headache.
No, not yeah, but I think it's because of the screen time since we've all shifted to an online mode. So I think
Yeah.
it's because of that. Otherwise, I don't take coffee. I don't have any stress at all. I'm completely stress free.
So one thing which we can all do and will suggest to cut down this migraine is to do meditation and yoga.
Okay. Okay.
They help in our relaxation of brain and they have a role in migraine.
Okay. We'll keep it in mind. So we don't have any live questions. So thank you so much for joining us, Dr. Rahul
Okay,
Saini, and for the informative talk that we had. Thank you so much, Doctor.
okay. Thank you. Thank
Okay.
you.